Hi, my name is Dr. Sandra Dorman, and I'm the director of CROSH, the Center for Research in Occupational Safety and Health. This is the first discussion from the Northern Ontario Community Immunity Series. To see the entire series, please visit our website at crosh.ca. That's CROSH.ca. Today we're talking about what is community immunity. And to address this topic, we want to address herd immunity, which is basically that when you've developed an immune response to a virus like COVID-19, you protect other people from getting infected. And the reason why that is because when an individual has an infection, like a viral infection, they're producing virus and they spread it to other people with COVID through the air. One person who has the disease can infect up to 6 to 8 other people. And those 6 to 8 people can infect another 6 to 8 people each. And so you can see how you can get a pretty quick spread of virus, right? Whereas if the infected person comes up against someone who has immunity against the disease, this person is not going to catch it, and therefore they're not going to spread it to 6 to 8 other people. And so in that sense, I like to think they're like providing a shield to the community, and that's herd immunity. And the more people that are in a community had immunity against COVID, then far fewer people within the community would become infected. When you look at how do you develop this thing called immunity, well, you can get it 2 ways. One, you can come in contact with somebody who had the disease, who infects you. You get sick from the disease. In the process of being sick, your immune system is stimulated, and hopefully you're able to stimulate a strong enough immune response to overcome the disease and recover. And then in the future, your immune system remembers that disease and you shouldn't get sick again. That's what people call a natural immunity. The other way we can protect ourselves through immunity is with vaccination. And with vaccination, your body still develops an immune response to the disease, but you never get exposed to the disease itself. Between those two methods, we prefer vaccination because if you never get infected with the disease, not only will you yourself not get sick, which means you won't go to hospital, you won't die from the disease, but in addition, you can't spread the disease while you're developing your immunity to other people. The mechanism of immunity between the two methods, it's not always the same for people who get it in the natural way, and because of that, the literature shows us that vaccines on average give a better immune response against the disease to protect you from future infections. And so even if you've had the disease, it's still recommended that you get vaccinated to protect yourself and your community. That's the prime reason for why we want to develop a herd immunity. But there's another reason that I want to talk about, which is whenever people get infected with the virus, there's the potential for the virus to mutate. And mutation is a concern because some mutations will lead to a more infectious virus. If you look at the original strain of COVID, for example, for every one person that was infected, 1 to 2 other people would get the disease. With Delta, the strain that's currently predominating our communities, for every one person that gets infected, 6 to 8 other people get the disease. So that means Delta is much more infectious than the original strain. And the more that now Delta spreads to people, the more chance that the virus is going to mutate again. And we don't know how infectious the next mutation is going to be. We also won't know how well our current vaccines work against the next mutation until it happens. So it's important for people to get vaccinated as quickly as possible so that we prevent this mutation effect and prevent the development of a worse variant of COVID. Currently, public health experts suggest that we need 90% of Canadians to be vaccinated, or 90% of the people in your community to be vaccinated to reach herd immunity against the Delta variant. I know people are confused because that number has gone up from what they originally said, and the reason for that is because Delta is so much more infectious than the original variant. The better a virus spreads, the more people within a community need to be vaccinated to protect the vulnerable people within our community. And right now, the biggest group is our children under 12 who cannot get vaccinated and are very vulnerable. We need people to get vaccinated to that 90% to protect this enormous population of Canadians. I would also highlight there are people in our community who are immunocompromised and either can't get vaccinated or can't develop a strong enough immune response even if they are vaccinated because their immune system is compromised. These people also need their community support to protect them from getting that disease. And I would highlight that the elderly population who may have already been vaccinated fall within that group because as you age, your immune system is not as robust as it used to be. And so you may be more vulnerable to still getting COVID if your immune system is compromised. So again, the more healthy, strong people who get vaccinated, the more everybody in the community benefits from that. I'd just like to remind you that all of the vaccines that have been approved in Canada are highly effective at preventing severe illness, hospitalization, and death against the variants of concern that currently exist. For more information on how vaccines work, tune into our video on how do vaccines help my immune system to protect me from COVID-19. And we'd also like to acknowledge the Natural Sciences and Engineering Research Council who funded the Northern Ontario Community Immunity Series. Thank you for your time.